That's what that was. Okay, good, because I had problems yesterday. Thanks.
Thank you for letting me join for Debbie Toth. She'll be on shortly.
Oh, sure, Holly. Thanks for taking the time to join us.
Sure.
He is wrapped up back-to-back meetings, so
Yep.
Yeah.
we'll just give it another minute and I think we'll get started and keep letting folks in as they trickle. It's going to be a big group today, I think.
The start of the year.
Yeah.
And if you want to turn off my note taker, I can't go into my chat. You can just say opt out.
It's fine. I've let your note taker in and I'll open chat. That was a reminder for me, I think.
Oh,
Maybe.
okay. Yeah.
I'll be honest, Donna, we're kind of exploring how to use AI to help us with note taking as well.
Big.
So I know it has its pitfalls. We've had an AI bot join and it kept putting in the chat that it wasn't able to hear anything and was going to hop off. And, this is a nice group. Everybody's trying to support this bot. It was
Yeah, I usually, because you already give notes, so I'm just going to opt out.
Yeah. Whatever you're comfortable with. I know that
Yeah,
Nancy's
that's fine.
recording this and we'll have a summary. I'm hoping
Yeah,
to get it out tomorrow because I know that a lot of folks were interested in this conversation, but finding a time that works for everybody is, it's a challenge in its own.
I know.
All right. Well, Nancy, if you don't mind keeping an eye on the waiting room and letting people in, I just want to thank everybody for joining the meeting today to sort of go over the governor's budget and then have a discussion about that. I've prepared a quick overview of sort of the top line items, and it's cobbled together from resources on the e-budget site, the Senate and Assembly summaries, as well as articles and op-eds that have been circulating over the past few days. I can't promise it has everything, but hopefully it's a pretty comprehensive summary. And please encourage others to chime in if there's anything that we missed during the discussion. So we'll touch on budget actions related to our policy space, but I also want to kind of take us out into the broader landscape and take a look at issues that will have weight in the decision-making process leading up to the adoption of the budget in June. And again, of course, there'll be time for general discussion. So I encourage you to hop off mute, share reflections, any items that weren't covered, and ideas for how we as a body can proceed in the months ahead, where we want to sort of focus our efforts. So Nancy, if you already got the slides up. So just a general overview, the 2025-26 budget is in a stronger position compared to last year. And that's due in part to a stronger economy than previously anticipated, as well as the multi-year budgeting approach that was seeded in 2024, which includes the planned withdrawal of funds from the state's primary rainy day fund. I will say the planned withdrawal of the rainy day funds was a deal that the legislature reached in the last fiscal cycle, but it's drawing some criticism with sentiment that, are we in a better fiscal position if we have to lean on that 7.1 billion from reserves to create a balanced budget? So there's been some kind of back and forth on that piece. Overall, revenues are up by about $16.5 billion. But at the same time, spending commitments have also increased. So one example that was highlighted during last week's call with Secretary Johnson was Medi-Cal, where the costs have grown as a result of increased caseloads and increased pharmaceutical costs. And so there's an additional appropriation there. With all that said and done, the administration estimates a pretty modest surplus of about $363 million. And the governor's budget allocates these surplus dollars to a number of previously planned one-time funding efforts, as well as new programs. I do want to say, it's likely that the LAO may provide a different figure, but the general consensus is that even if the surplus is calculated differently, the adding of new spending would require either cutting spending proposed by the governor, reducing reserves, and or increasing taxes. And I think there are three big buckets I want us to keep in mind as we kind of move through, as we move through the process. So one is that there's a lot of uncertainty about the implication of the incoming federal administration. And depending on what reforms roll down the hill over the next few months, we may or may not see some stark differences in the May revise. And this was something that the governor alluded to in his address earlier this month, basically saying, we don't know, the bottom may fall out. So a lot remains to be seen on this front. Two, I think we are all very aware of the crisis that continues to unfold in Los Angeles. It's tragic, horrific. People have lost their homes, their communities, their schools, their places of worship. And the legislature has previewed that issues related to the fires will likely be at the top of the list in terms of what we may expect to see in the May revision. And just to say, I think we're already seeing some traction in this space. This past Monday, the governor announced that the state will provide an additional $2.5 billion in funding for fire response and recovery. I don't believe that's currently reflected in the proposal that just came out Monday. And by the way, for those of you who are interested in this, Justice and Aging has circulated a sign-on letter urging leadership to prioritize the needs of older and disabled adults in the distribution of this funding, underscoring the disproportionate impact for this population. And of course, you know, as we learn more about the victims who succumbed to the fires, we're seeing much of the same familiar trends that we've seen in past emergencies. It's largely older adults and people with disabilities who, for one reason or another, weren't able to evacuate safely. So I'll pop that link in the chat shortly for anyone who'd like to sign on, and we're reviewing it as well to see if that's something the collaborative can sign on to.
Hi, Maria, it's Yasmin. I'm on the call, so if folks have questions, I'm happy to answer about the letter. And I also just put the link in the chat. Thanks for
Awesome.
highlighting.
Thank you, Yasmin. Yeah, I thought it was a really great, well-written letter. So I just want to make sure that's on everybody's radar. And I think the third bucket that comes to mind is that there are some big decisions ahead on housing and homelessness. The administration is looking for additional accountability on the use of existing funds, and the proposal outlines the intention to sort of reorganize the Business Consumer Service and Housing Agency to create a new agency specifically focused on housing and homelessness. And there's also a proposal to launch a website that would provide local level metrics. But at the same time, the budget includes very little or no new money for housing and homelessness programs. And much of the funding for existing programs is set to expire. So I think that's going to be another kind of big bucket of conversation taking place. Okay, in terms of, healthcare, again, the governor's proposal increases the Medi-Cal budget by $2.8 billion in general fund for a total of $188.1 billion in fiscal year 2025-26. And this increase is largely attributed, again, to the growing caseloads and higher pharmaceutical costs. And given the rising cost of pharmacy expenditures, the administration is committed to continuing evaluation of the drivers of prescription drug growth, including the impact of pharmacy benefit managers. The proposal also projects general fund savings from the recently enacted MCO tax. It was estimated at $7.9 billion in 2024, $4.4 billion in 2025, and $3.3 billion in 2026. And it makes some adjustments to reflect the passage of Prop 35. So it renders specific provider payment increases that were approved through last year's budget process inoperable as of January 1st of this year. And unfortunately, that includes our friends and colleagues in the CBAS space, congregate living health facilities, and a handful of other provider types that were not initially carved into the draft MCO spending plan. And, oh, sorry, did someone want to jump in? At the same time, it does reflect provider rate increases for primary care, maternal care, and non-specialty mental health services, with this caveat that the final MCO spending plan is subject to consultation with the Stakeholder Advisory Committee. And I'm hoping that makes sense. I know this was a pretty complicated piece of policy that we waded through last year. I think the real big thing here is that the proposal, the governor's budget proposal, reconciles language from the 2024-25 budget and brings it into alignment with Prop 35. The proposal also acknowledges federal approval of Behavioral Health Connect demonstration waiver. That provides $8 billion to support HCI, DHCS, and DSS in expanding the behavioral health continuum for Medi-Cal members, including individuals experiencing or at risk of homelessness, among other populations of focus. It also includes $8.5 million increase in ongoing funding for the AIDS Drug Assistance Program, known as ADAP, which will be used to enhance access to medication and reimburse the Medicare Part B premium payment program for ADAP enrollees. One thing I want to highlight, because I know many of us are invested in efforts around Medi-Cal share of cost, I just want to highlight that once again, there's no mention of reform in this space. So as you may remember, this was something that was approved in fiscal year 2022-23. It was subject to appropriation. In 2024, we had an economic downturn. We had a budget deficit. So it went, there was no commitment there. And all is quiet on that front again, despite having a better fiscal outlook. On housing, one thing that was really clearly elevated in both the Senate and Assembly digests of the proposal was the omission of additional resources for housing and homelessness. There's no new funding. No new funding for the low-income housing tax credit, no new funding for DSS administered programs beyond what has been included in previous budget cycles. And with that, I think it's just really important to flag that funding for HomeSafe, which has been a pretty successful program, is on track to run dry in this fiscal cycle. So without some sort of new commitment, we can expect that program will effectively end. On the nutrition front, for those of you tracking access, no major changes to CalFresh or emergency food programs. And the legislature highlighted that the budget reflects an expiration of one-time funding for Cal Food Program. This funds food banks. We know a lot of older adults, people with disabilities rely on that. And the expiration of that one-time funding will result in the budget reverting from its current $60 million augmented amount to the $8 million baseline starting July 1st of this year. There's no major developments on the IHSS front, although, sorry, go ahead. Does anybody want to jump in? Okay. There's no major developments on the IHSS front, although the proposal elevates that the IHSS collective bargaining report is due to the legislature. I'm sure we'll see that emerge soon. And I'm sure that we'll see collective bargaining efforts resurface back to the limelight, but more on that as things develop. Sorry, you guys, little background noise at home here. There are no major adjustments to SSI SSP, so the proposal is holding steadfast on additional dollars that were committed during the last funding cycle. I also just want to highlight the Department of Developmental Services is set to receive a minor increase in funding. That's largely attributed to children aging out of Head Start. So we're talking about 40,000 individuals. And the proposal also underscores the administration's plans to release the master plan for developmental services in March 2025. But there's no mention of funding specific to implementation once that plan is released. The Department of Aging will also receive a modest funding boost from the HICAP fund to cover modernization of the program in line with the HICAP modernization business plan and strategic roadmap. These documents are anticipated to be released in June 2025. By the way, the Department of Aging submitted 2 additional budget requests that were not reflected in the proposal. One would have supported 2 positions within the MSSP division and enabled CDA to acquire and implement a new case management software system. And the second would have created 4 new positions to support federal compliance with the 21st Century Cures Act. And I don't think it's surprising that the additional positions were not included, because we have 6,500 vacant positions that have been eliminated. Operational budgets have been slashed. I think it's 7.5% across most all departments. So really it's kind of reeling in. But I do think it's worthwhile to note that last Friday, I did hear Secretary Johnson mention that as a result of this, the kind of reduced capacity, we may see some delays in the implementation of initiatives. And this is coming at a time when we're on our 4th year of the Master Plan for Aging implementation. Sorry, you guys, I'm going to mute and yell at my children. Just give me 1 second. Sorry about that. 4 o'clock, everybody's home. Anyway,
Maria,
yeah.
check to see if I'm on the right slide.
Sorry, we're back one, Nancy. We'll get to that next. You can just keep it up. So anyway, this is really coming at a time when we're our 4th year of MPA implementation. The next iteration of the master plan initiatives are set to come out soon. There's going to be probably about 70. A tremendous amount of work across a multitude of departments is underway, and will presumably be adding to those efforts with the master plan for developmental disability. So, you know, just something to keep in mind, that as the belt tightens, we may see a little bit of slowing in the timeline for implementation. Okay, so we're on the right slide now. Again, nothing really major coming down the pipeline in our policy space, but there is a small surplus. So the question is, where is the administration intending to put these dollars? Again, there's a proposal to separate and reorganize the existing Business, Consumer Services, and Housing Agency into 2 new agencies. We'd have the Housing and Homelessness Agency and the Consumer Protection Agency. It's not quite clear what that will look like just yet. It's anticipated that additional details will become available in the spring through a reorganization plan submitted to the Little Hoover Commission. The proposal also includes an investment in a diaper program, and that allocates $7.4 million in 2024-25 and $12.5 million in 26-27 to provide California families with newborns access to a 3-month supply of diapers at no cost. Anybody who's had kids know that they go through a lot of diapers in those first 3 months. There's also $40 million outlined for schools aimed at screening for reading difficulties. And the proposal is holding steadfast on the administration's commitment to expand early education programs, including transitional kindergarten. The administration is also hoping to continue expanding the number of firefighters in the state by recruiting an additional 700 professionals, bringing the total to almost 10,000 within the next fiscal year. And a really interesting article from Cal Matters outlined that the state has been making some really great progress in this space, really focusing on that, given the increased intensity of wildfires. So just as a point of reference, Cal Fire had about 5,800 firefighters just 7 years ago. I think another thing that's important to highlight is that the administration has some flexibility with the voters' approval of Prop 4, focused on new climate spending, Prop 2 focused on school facilities, and Prop 1, mental health housing, and the appropriation of these bond dollars is reflected in the proposal. The administration is also proposing to carry forward with some cuts that were agreed to in the last funding cycle. Again, that includes the 7.5% reduction in operational costs across nearly all state agencies. There's the elimination of the 6,500 vacant positions, lower spending on state prisons as well as UCs. Community colleges will have a small influx of funding, about 100 million, aimed at providing students with course credits for prior work experience. This is in alignment with the governor's plan for career education and the overhaul of job training programs. And the last thing I want to say on this front, again, none of these are really in the aging and disability space, but I think it is important to have sort of a broad overview of where the momentum is. The last thing on this front, which you may have heard from the Department of Finance during the budget live stream, the governor's office is aiming to increase the percentage of funds that are deposited into the rainy day fund, upping the cap from 10%, which was approved by voters in 2014 via Prop 2, to 20%. And that change would require voter approval. I think the Department of Finance has sort of framed it as being able to, enabling the state to stash more money during the upswings and mitigate spending cuts during economic downturns. So something to keep in mind, this is an objective. Yeah, and I think we're on the next one, Nancy. So all in all, when it comes to aging and disability programs, I think the governor's budget certainly falls short. And just to be clear, there's no big ticket cuts outlined in the proposal. And I think in that, you could say that the proposal upholds previous commitments. At the same time, it fails to increase investments to meet the pressing needs of this population. And in some cases, like with HomeSafe, just purely through inaction, it takes us a step backwards. And I know that there's been some criticism bubbling up over some of the tax proposals that are included. For example, the California Film and Television Tax Credit. There's definitely messages circulating about the need to be really thoughtful about how we invest in ways that support Californians in managing the high cost of living. So just kind of a lot to take in. And I want to pause there and just hear from you all any reflections, anything that comes top of mind. Anybody? All right. Okay. We'll go to Sherry and then Donna.
You knew that some of us would have comments. It just took us a minute to find our buttons. Thank you for this very, very thorough, quick, but very thorough overview of some of the highlights. Yes, I've been concerned since last year about the planned cuts to housing and homelessness support. We have not only, continue to have folks that are unhoused, but the number of people who are newly unhoused, and that includes a large percentage of older adults, continues to grow. And we just continue to add to the homelessness population by not addressing some of these issues long term. While the state made, some significant investments during the pandemic and a couple of years after, the cuts and lack of continued funding for some of these programs, including, as you mentioned, HomeSafe, are just very, very disconcerting. And I fear that we're going to end up with just, increased skyrocketing folks that are newly homeless, especially also because we haven't dealt with trying to figure out how we can fund some short-term, rent assistance for some of the folks that are most at risk of losing their housing. And that's what we find with many of the folks in our county who are referred through the Home Safe program from APS, is that, they are at high risk. And without the Home Safe program, they end up going into homelessness or institutionalization. So I just hope we can figure out some ways here where we can, since there is a surplus here. It's not huge, but there's some money available here that we can prioritize continuing to fund some of these programs and work with our legislators to prioritize these services for continued funding.
Thanks, Sherry. And I will just share, I mean, both in the Assembly and Senate summaries, this was highlighted as a place where it feels like there is a gap. And so I think there is a conversation to be had, and at least an appetite to have that conversation, because Home Safe is a very effective program, and it would be a shame to have it expire because of lack of reinvesting in what we know is working. Okay.
Right.
Yeah. Donna?
First of all, thank you for this, as I said, this really great summary that helps kind of get our thinking together on where the gaps are. And for the issue around our people who are caring for older adults and our family caregivers, I think that the points that you said around that, although we don't have any major cuts, the programs in effect are getting cut because we are seeing a growing need in our programs too. The other thing that around homelessness, and I've been asking people whenever I talk to someone who's dealing with housing and homelessness, is within that growing population of older adults who are homeless are probably a significant percentage are people who were caregivers who lost their housing. And so I don't know that we are really, that's where the temporary rent assistance might help them transition to new housing arrangements, but sometimes they're just like immediately upon someone passing away. They lose their housing right away, and they don't, they're older, so they're not going back into the job market as caregivers. And so we're seeing those 55-year-olds to 65 who are family caregivers. And so I've been thinking I was on a national call, and they were saying like maybe we should have a caucus, because they're at other places, they're actually looking for a caucus of family caregivers. And I don't know if that might be something we want to look at to, within the legislature, begin to have people recognize that this could be something that could help bring a lot of people together across the spectrum in our legislators.
Yeah, absolutely, Donna. I think that sounds like a fantastic idea. Renita and then Monica.
Hi, everyone. Thanks, Maria, for this overview. And I'll just say that I do kind of echoing what other folks have said about the Home Safe funding, and it'd be a shame for those programs to end. And I just kind of looking at your point about the budget falling short on aging and disability. I do, there's not a lot in here in the budget on aging and disability, but I did just want to add one thing, which it's not really part of the budget, but it's top of mind for me. So in last year's budget, there was trailer bill language that required the Department of Social Services to work with CWDA as well as a couple other stakeholders on revising the budget methodology for IHSS. And so that is work that I'm actually working on with Department of Social Services right now. And so even though it's not in the budget, there is, and I don't know if there's going to be something in the May revision, but that's something that's being worked on, and there could be something at another point in May relating to IHSS. So anyway, I just wanted to add that point there.
Thanks so much for flagging that for us. Yeah, we'll have to keep an eye out for it. Monica and then Carol.
Thanks, Maria, for this amazing overview. I just wanted to speak to a little bit of the home safe. So we're working with a small group right now and spearheading some a budget request right now. So we're kind of gathering data from SoCal to NorCal just regarding what it is the run rate for home safe so that we can put together a legitimate budget request regarding home safe, and it's just to push for ongoing funding. And we know that it's going to be an uphill battle, but it's we just did one initial meeting, and if anyone is interested in being a part of that, it's just anyone who would like to kind of push for that home safe. But that's kind of something we were kind of took on a little bit. So I just wanted to speak to that because I know that's a concern for many of us, and so there are a few of us that are already kind of working on that. So again, it's just for ongoing funding, and if anyone's interested, we have a meeting on the 29th to kind of discuss it and see where we're at. So
thanks, Monica. Thanks for extending the invite. Carol, did you want to jump in?
Yes, and it's perfect for me to follow Monica because I wanted to share that we are actually equally dismayed about HDAP and home safe. And we were bringing to the commission meeting next week, potentially actually submitting a budget ask for those two programs, Monica. So maybe we should connect offline, but we're looking at that as well because we think it makes no sense to let these programs go away when they're more effective than other homeless programs, like double the effectiveness. So we have the data to prove it. So I'm hoping that we can, work on it and get I know the legislature, they have been briefed as well. So hopefully they'll be interested and want to support the programs. But again, until the commission approves it, we won't be doing it until they actually approve it. I'll keep you posted.
Thanks, Carol. Yeah, keep us posted. Jason, I saw your hand go up and then go down. So I don't know if you changed your mind or you want to.
I was just applauding that statement. Thank you, Carol.
Oh, sorry. It looked like a hand up. Anybody else want to share? So
are we sharing, Maria? I apologize.
Share. Jump in, Debbie.
Holly was here for the first half, so she's gonna help fill my brain. But what are you asking people to share out? Their heartbreak?
Their heartbreak, their reflections, what they're working on. I mean, anything really, it's just an open discussion related to the budget. And Debbie, I know that you mentioned there was something about MSSP. I searched far and wide, so I don't know if you have more info on that, but
it was related to an increase, which is why I'm so confused why there would be an increase to MSSP in the midst of removing massive programs. Not that I'm complaining. We're not getting a slot increase, or I don't even think it's a rate increase. I think it's something that funds actually the software that we are compelled to use because it's such a complicated, ridiculous federal waiver program. But I'll get it and send it to you, Maria, because I don't even know enough about it at this point to speak intelligently about it. But I do want to understand how folks think that we're going to be impacted by the budget and how we're going to end up aligning and what we're going to do to fight the battle.
Yeah, that sounds great, Debbie. I welcome that. I did read that CDA had asked, they had a budget ask for one, it would fund 2 more positions within MSSP under the department, but 2, it would fund the program that you talked about. And I didn't see that actually in the budget. So I don't know if that went through, but I might be missing something. So if you can share, that would be great. And I can circle back with folks to keep everybody updated. Any other reflections? And if not, maybe we can pivot to talking about next steps in terms of our advocacy efforts. I'm hearing a clear kind of vision for advocating around housing and homelessness as it relates to older adults and people with disabilities. I'm hearing kind of the idea of a caregivers caucus and making sure that we kind of talk about caregivers in the space of homelessness and housing. Anything else that surfaces?
Yeah, if I could. So, Hi, everybody. Really appreciate this, Maria. And the whole home safe issue flew under my radar. So I'm glad you raised that because I didn't know. Either way, I don't know how many folks have heard some chatter that the budget proposal, or at least parts of it, could be moot because of the fires. I don't know if anyone else has heard that. I've heard that from
Yeah.
two different good sources, not just like rumor mill kind of sources.
Yeah, I will say, Nina, sorry, I turned off my camera, forgot to turn it back on. It was clearly outlined, I think, in a number of documents and a number of articles related to the budget that we don't know what's coming from the federal administration. We don't know what kind of pivots California will have to make. Certainly the fires are top of mind right now, and mitigating and recovery efforts are top of mind. And so the May revise may look very different. There's a special session. I know Yasmin, as she raised, was part of the presentation too. There's been a $2.5 billion allocation. I don't believe that's built into the governor's proposal. I think that's being tagged on. And so where does that $2.5 billion come from? I imagine that we'll see more, and anybody's guess on where we land with the May.
So if I could, I'm aware that about the federal challenges and all that.
Yeah.
Trying to maybe put this another way.
Yeah.
The moot comments, I can't attribute, I wasn't in the meeting, but I've heard this from two different people that were privy to it. Moot. Like, I understand they're going to make changes.
Yeah.
But I'm wondering if starting today, I was kind of looking forward to Wiener's. I thought they were going to have a budget hearing yesterday, and they didn't. And they canceled it to see what they were going to say. But there could be some big changes, and because so much is going to have to be devoted to recovery, and we don't know how much we can depend on our friends in DC. So I don't know if folks heard that, but I'm just going to say two different sources that are well placed, and not just, based on an actual conversation that has occurred recently, post budget announcement.
Yeah.
Yeah.
I think that's probably the right sentiment. I think that's probably going to play a big role in where we are in May with the May revise. Yeah, absolutely. Anybody else? Tony, do we have anyone from CFILC, ILC on the disability side? Any big things bubbling up for you all?
No, we had the growth budget. We are expecting a lot of growth. So the system is now anticipated to be about 500,000 people with developmental disabilities by the end of next budget year. So it's a lot. Of course, the largest in the country. And the budget now is increased to, the projection is $19 billion, which is, again, one of the largest systems in the country. So, that's good. It means that, we're getting the funding to meet the growing needs. Autism is by far the most common diagnosis now. It is now, it's always intellectual disability. The system was built around people with intellectual disabilities in the beginning. And then, brought in all the other developmental disabilities. So it is real. The growth in that area is real. So that's the other piece. And then the Public Records Act is a new thing for regional centers. And so they'll all now be held accountable to a request from the Public Records Act, which I had no idea what that meant, but actually it's a lot. So, so now all my years in advocacy and doing the things I did to those 4 departments, I apologize to all you department people, but that is a lot of work. So, but I guess there'll be a lot of attorneys that will be employed for now on. So that's somehow going to help people with developmental disabilities. He says with jaded glasses.
Thanks, Tony. And as we're thinking about, the budget going up for the Department of Developmental Disabilities, we're thinking about more people who are aging with developmental disabilities. I think it just more so underscores the connection between all of our programs. As they continue to age, they will be part of the aging system. And so here we are. So it's nice.
And our caregivers, we have a lot of aging caregivers.
Yes.
And it's become increasing increasingly important to figure out what we're going to do to support our aging caregivers.
Thanks, Tony. Dan, did you want to jump in?
Yeah, this is Dan Oakenfuss from CFILC. Glad to be here. Thank you very much for the presentation. One of the things that I know CFILC will be working on will be with our LA-based independent living centers that are, just going through all their emergency supplies and disaster relief services, due to the fires. So we have at least 3, maybe 4 ILCs that have fires or evacuees in their catchment area. So it's really going to be a needed and concerted effort to try to shore that up, because a lot of our centers are working directly with the consumers that are evacuated. So it's really important for them. Secondly, on a related note, we'll probably be working with our friends over in C4A. As you know, Christina Mills is now the executive director there at C4A. And over the last 2 or 3 budgets, we've partnered with them on trying to boost funding for the Aging and Disability Resource Connections programs offered by CDA. And it's been underfunded. We have a lot of centers that want to come online and be partnering with their AAAs to provide these necessary connections. And it's the budget dust funding that it's been getting over the last few years has been very minimal. So we're just maybe seeing we can find some coins underneath the couch to boost that up a little more.
Thanks, Dan. Well, keep us posted. I know that was something we talked about last year.
Right.
Ray elevated that request, and it was definitely on the top of our list for support, as we do want to see that program succeed. So let us know how those efforts come along.
Yeah, we'll do.
Thanks. Anybody else want to share? And if not, maybe we can pivot to talking about next steps. Okay, seeing none. So what do you guys want to do? Do we want to do a letter? Do we want to call people? Like what would make sense for the collaborative to do jointly in response to the budget? Should we have a response to the budget? Or are we all kind of feeling like at least we're not getting cut? I don't know. Definitely a lot remains to be seen.
This is Debbie. Hi, I think it's important that we acknowledge that we're paying attention because if we say nothing, we don't exist. And I think the more that we have a voice and the more that we participate in each step of whatever the process is, that it's important because we're a force. We're all these bodies and organizations. We're throughout the state and we're watching. And I think it's been this groundswell of our voice in various different roles, whether from the Stakeholder Advisory Committee or CCLTSS or through Justice and Aging, or Disability Rights California. I mean, we have had some pretty historic changes in the status quo related to our industry. So I think it's important that we do say something. I think we say thank you for not obliterating our programs. However, we have these remaining concerns. I think that's the way that we structure something like this. And we certainly understand that things may change given that our state is in a state of emergency. And we just want to make sure that we continue to protect those who are most vulnerable. Something along those lines. I am not the wordsmither, just idea person.
That's okay, Debbie. I mean, I can draft something and share it with folks, and then you let me know if we're on the right track or something's missing. You want to wordsmith on your own time and let us know where the changes need to happen. Happy to kind of walk us through that process. I agree, Debbie. I mean, I think a response is better than none. And we can definitely elevate some of the concerns that have been raised on this call. Home safe caregivers, those things that we're clearly not seeing in the budget that are really important.
Maria, do you think we could include some anticipatory language that, we recognize this is a dynamic situation with the crisis, but kind of some way to say, please don't take the money out of our services to fund it?
I think we need to, Barb. I think we, try to get ahead of the ball on that one. Because I think it's clear that the May revise is not likely to, I mean, in my mind, at least, the May revise is not likely to look like the proposal because of these, factors.
Agreed.
Yeah. Yeah.
Hey,
All right.
Maria, it's Yasmin from Justice and Aging. We had been similarly considering pulling together a budget letter from aging and disability advocates, sort of outlining similar, all the things that we've already talked about on this call. So obviously the letter in response to the LA fires has sort of put our plans to do the budget letter sort of next in line, but I am wondering if the collaborative, if we want to sort of combine forces or if we want multiple letters. But I also recognize that it's a lot of asks for a lot of people to sign on to things and whatnot, and so if there's a way that we potentially want to streamline our efforts here, and you and I can talk offline as well, but just wanted to flag that.
Yeah. Yasmin, I'd love to. I mean, I'm not a fan of recreating the wheel, and I think that we can kind of work together on that. So yeah, let's connect offline and we'll strategize about getting a letter out, a response out to the governor's office and legislative leadership about, what we've been talking about. All right. Anything else that comes to mind on the state budget, or if you have any other things you want to talk about? We have 10 minutes. We can end early. We can skip out of our offices or finish up the last few things we need to work on, or if there's anything other folks want to raise or chat about. Dan.
Yeah, I think it's a great idea for all of us, to connect with the new kids on the block, the new legislators, and they're not all kids, of course. But it would be great to, for those who are not in Sacramento, meet with them in their district offices and just kind of introduce, who we are and, what really matters to us. Because that's really important. So they know that we are a, significant advocacy organization here that, really wants to protect our interests and for seniors and age and people with disabilities. So
Great,
that's one
Dan.
strategy. Is the district offices. We do that a lot with our independent living centers all across the state. But secondly, back in Sacramento, yeah, when they start doing the budget hearings and subcommittee hearings, yeah, we should just continue to take advantage of that public comment and just full court press, just continually going there and repeating our talking points. They do listen.
Thanks, Dan. Yeah, I've got to work on shortening my public comments. I agree. I mean, I think, last year we did a great job of sharing all the budget hearings and things that were coming up and trying to just get bodies in the room to provide public comment. And I saw the result, which was we did have aging and disability voices. And we were competing with early childhood education groups in terms of bodies in the room. So I think definitely keeping up those efforts. I know our regional coalitions through the Collaboratives Grant Program will be reaching out to district offices and making those connections in district. We certainly have our advocacy day. I think those dates are, Nancy, you might have to correct me, May 6th and 7th?
Yep, that is correct.
Yeah. We'll get a save the date out soon, but in the meantime, we do have an advocacy day plan. Dan, I think to your point, let's not wait until May to meet these new people. Let's go make those rounds. I know that individual organizations with the collaborative are planning to do that. I think it would be great to organize some small groups, folks in Sacramento who don't mind popping into the building to just walk around and collectively raise some of the things that we're working on, some of our priorities. Just let them know that we all meet behind the scenes. We have our own meetings. And we talk and we touch base, and I think there's a lot of really great synergy here, and just elevating that would be great. So lots of work ahead. All right, last call. Any other comments? Okie dokie.
Yeah, I did just want to say where we can tie their decisions to the impact of victims of the wildfire, like HomeSafe. Right?
Yes.
We've got to do it. It's all going to be all wildfires all the time. So I'm thinking, I'm writing my boss about what I just learned about HomeSafe. And I was like, These are really bad times. Eliminate, it should never be a good time, Renita, but this is an especially bad time. So that's all I wanted to say. Prior to the disaster.
Thanks, Nina. Thanks for flagging that. I mean, I think that's our challenge for the year ahead. It's obvious that there are really big critical issues happening in the state. And I think our job will be trying to tie in aging and disability and just be really mindful about this population in all areas. It comes to fire, it comes to what's happening at the federal level, it comes to housing and homelessness, you know, again, just bringing that conversation back into our space. And if anybody is interested, we do have a subcommittee sub-work group meeting coming up. I think it's tomorrow to talk about starting to position ourselves for messaging and things around our policy priorities. So it's open to anybody who wants to join. I'm happy to send the info out to sort of the broader policy committee. If you're able to hop on, feel free. Okay, everybody. With that, happy Wednesday. Hope you have a fantastic rest of the week, and we will be talking again soon.
Thank you, Maria.
Bye, everybody.
Thank you.
Maria.